Next topic is again along the same theme of the symptoms that we hear often and research has shown our patients talk about, is fatigue and pain in ECD. And we don't know why this happens exactly. We do know it is quite prevalent now. And a lot of times in my practice, I look to our palliative or supportive care colleagues to help us with those cases. And that's why I'm very glad that Dr. Richard Taylor is here to talk about this important topic, especially root causes, practical strategies for energy, relief, and resilience. He's an assistant professor and associate scientist in palliative and supportive care at University of Alabama at Birmingham. He has lended help in numerous cases so far with histiocytosis. He has a very unique and holistic perspective to care for the patients and their needs beyond just what the scans show. So I'm very thrilled that he and his group decided to join us. Please give him a warm welcome.
Thank you. Thank you. I appreciate that. So I appreciate the opportunity to talk to everybody today, and I am palliative supportive care, and I have many, many years, because I'm very old now, of oncology care, okay? So that's my background, and what I want to say is that my approach is a little bit different, and so I think you'll see that today as we go through the slides, but I feel particularly listening to all the stuff the information I've listened to today, it aligns very nicely. So I don't have any disclosures. Nobody's paying me any money, unfortunately. So, and let's see, pointer. Okay. So my core objectives today is to talk about sort of the biological roots of fatigue and pain and ECD, explore the interconnected roles of inflammation and energy metabolism, introduce evidence-informed self-care strategies to reduce symptoms and really support recovery, and empower patients and families to take an active role in improving their quality of life. So it sounds very fancy, but we'll get to the meat of the matter here. Oh, I'm going backwards, aren't I? Sorry. Okay. So I like to use this picture here because I think this really gets, no pun intended, to the root of the matter. But this visual metaphor is, you see the tree and then all the roots underneath the tree. And everything, when you look at the tree, it looks fine, doesn't it? Everything looks okay on the surface. But when we dig deeper into the root system, the systemic issues of inflammation, mitochondrial dysfunction, all those things that drive the symptoms of fatigue and exacerbate pain or opportunities for us to have interventions. And so that's kind of what I'm going to talk about today. So we can either put a Band-Aid on the situation, which oftentimes we will use pain medications, other things like that. I'm not saying that we don't do that, but that is really oftentimes just putting a Band-Aid on the surface if we don't get to the root of the problem. So I use this quality of life domains here, and these quality of life domains represent sort of the patient, and then always the caregiver is attached. And what's very important to us in supportive and palliative care is that the patient is in the center and the family surrounds the patient. Now, whomever the family is, now that may be the caregiver, the primary caregiver, spouse, etc. It may be the children that's helping take care of the patient. There may be friends, etc. So whomever is involved in the patient's care. So I like to use this because physical symptoms, and my talk today is on fatigue and pain, but I want to say that when you have a symptom, it negatively impacts your psychological, perhaps. You have fatigue, you have pain. I feel helpless, I feel hopeless, I'm depressed. So now we have a psychological ramification, if you will, of the physical. And then I am so fatigued, I hear this a lot, particularly here in the Bible Belt, I'm so fatigued that I can't get to church. And here in the South, that's a big deal, okay? And it provides spiritual support, and it also provides social engagement and support. So now I'm so physically tired I can't get to church, so therefore I'm socially isolated. So what I want to do is to connect all these things here and to say that if we can get to the root of the problem, if we can address some of the physical concerns, then it will have a domino effect on these other quality of life domains. Same thing for the caregiver. Over here may be experiencing fatigue, problems with sleep, etc., with helping with the patient. So their caregivers are experiencing alterations in their quality of life also. So now we got, and this center image here is representation of what affects the patient affects the caregiver, and what affects the caregiver affects the patient. And honestly, what I hear a lot in my practice is patients come in with their caregiver, and communication is a big deal. The patient doesn't want to talk to the caregiver because, well, I really want to say anything about my condition or anything because it's going to upset them. So, and then the caregiver says, well, I don't really want to bring this up because I think it's going to upset the patient. So what happens is there is no communication going on here, you know? And thank goodness that we have people like Sylvia and her team, other counselors that can help with the communication issue, right? So I think that's a big deal. So I belabor this point just a little bit because I think it's really important. Now this is sort of the root of the matter here. And I want to say what I've heard consistently throughout the day is that in ECD, you have chronic inflammation, right? You have chronic systemic inflammation. And what happens with that is the system is turned on and it's never turned off. So what happens there is the cells move into, this is what some scientists call cell danger response. Now, fancy word for meaning that the cells are just focused now, okay, I'm only focused on the danger. The inflammation markers are telling me, high alert, there is something going on. We need to stop producing energy and taking care of well-being because we've got a serious issue here. We got to focus on defense. So what happens then is that you have that shift. Like I said, you shift over to this cell defense versus cell nurturing and making energy and all those other things. So what happens? Wow, I'm pretty fatigued. The cells that are the mitochondria, the cells that are supposed to be producing energy, they're focused on defense. So we are not getting any energy, right? So then what happens is, you have the pain, and we've heard all today about the bone, the nerve, fibrosis, etc. But what happens here that wasn't talked about today is that with systemic chronic inflammation, the brain becomes hypersensitive to pain. So what seems to be perhaps out of proportion when a patient says, oh wow, I'm really in pain here. And you're thinking, what? This isn't any big deal. What? I don't understand. Well, because they're hypersensitive now. So this process produces this hypersensitivity, which then, as I said here, we're talking about mitochondrial reserve and increased energy. Now, I'm I'm going to break this down in just a little bit, but just kind of bear with me. What happens is you have this mitochondria, and I'm going to talk about what mitochondria are in just a minute, but there's sort of the organelle that produces energy is one of their functions. When you don't have energy and your body's requiring all of this focus on constant inflammation and defending itself, what happens is then this sickness behavior happens. You have this fatigue, brain fog, and that triggers more inflammation and dysfunction. Now this here, as another side effect of all of this stuff, or consequence of this, is that you have fatigue and this post-exertional intolerance, or the crash. And this is what I hear a lot from patients, is I just do a little bit and I'm just like wiped out. I can't do anything else. So this is not in your mind. This is a physiological response. Unfortunately, because the switch is constantly on, then this doesn't get any better. So what we have to do, and the reason I go through this in excruciatingly painful detail, are these are areas where interventions can take place. If we can focus on even the smallest way of decreasing inflammation, that would be helpful. Now, this doesn't happen, and I think Kevin mentioned this earlier, people don't come with just generally one issue, one disease process. Usually they come with, they may have diabetes, they may have other medical issues. And all of these things, can play and come into play with producing or heightening inflammation. So exposures to pollutants, poor diet, lack of exercise, which you mentioned earlier, infections, etc. So there are a multitude of things that can also produce this chronic inflammation. Okay, so just briefly, how many of you guys remember about mitochondria from your high school? And what everybody was taught was, it's the powerhouse of the cell. Well, mitochondria are much more than that, okay? They have many other functions. And as a consequence, when the mitochondria are damaged, inflammation will damage the mitochondria. And if we're talking about energy, and we know the mitochondria has a major role in energy transformation and production, then we have to get to the root of the matter and address those things that cause that. But the mitochondria do these other things, okay? So they do produce energy or regulate energy. They do things with calcium, and they help protect the cells from reactive oxygen species that can actually damage the cell. They do a lot of metabolic regulation. So the mitochondria are extremely important. And chronic inflammation will damage the mitochondria. There are other things that I'm going to talk about too that will do this. Now, why is this important? Okay, we've heard today what I've heard from various speakers. So ECD involves the cardiac, it involves the brain, it involves the eye, it involves the muscle. So how much do you think the brain weighs, sort of occupies percent-wise of the body? He was like, "Ooh, I don't know, it's pretty heavy." Mine's big, so I might say it's only about 2%. But it consumes about 20% of the body's energy. So the mitochondria is very high in the brain. So once again, if we go back to the root, if the mitochondria are damaged, and you're thinking, well, as Sylvia said earlier, I can't think, can't remember squat, I'm depressed, I'm anxious. An explanation of that is partly because of the mitochondrial dysfunction, okay? So once again, if we can help the mitochondria, if we can help keep it healthy, then we can decrease some of these symptoms. A different approach, but when you have a sense of what do I do, what can I do, a sense of helplessness and hopelessness, you know, what am I going to do here? Nothing seems to be getting better. Sure, we can give you things like stimulants and things like that to maybe help, but once again, it's the Band-Aid. And those medications oftentimes come with other side effects. Okay, this is just a quick overview of kind of what we've talked about. Chronic inflammation, the immune system stays on. What I've heard is it's like you've got the brake on and you're pushing the gas at the same time. All right, so that's kind of what the analogy is. Then you have the inflammation actually sensitizes the nerves and leading to this sort of widespread pain that people report. Yes, you may have the bone pain from where the lesions are, whatever, but people report to me, I just feel pain all over. I just have pain everywhere. Don't touch me, I have pain, okay? And as a consequence of the malfunction in the mitochondria and this chronic inflammation, then your body doesn't have enough energy. And we just talked about how many of the mitochondria are in the brain. So you don't have the energy to think. You don't have the energy. Okay? All right. So I'm just going to go, how much time do I have? I'm just rambling on. You know, minus 5 minutes. Oh my God. Okay. Okay, quick, people. Focus. No, good. All right, so just quickly, I'll run through this. You have the slides, and so the other part of this is that there is when we focus on the gut, is important. The gut has all these bacteria, trillions and trillions of bacteria, viruses, fungi, that's actually in the gut. And most people now are hearing about, oh, well, we have this gut microbiome that's really important for us to make sure is functioning well, because it can actually help decrease inflammation. The gut and the brain are connected. So if this isn't working well, this isn't going to work well. So, all right, so the gut microbiome, important. Supporting the digestion, nutrition is critically important here. And I'm going to just skip through some of this because I want to kind of get to the meat of the matter here. So what do? There's like 4 major buckets that we can address. So we nurture the gut microbiome, diverse, rich diet, fermented foods, sauerkraut, kimchi, kombucha, or kefir. If you can tolerate any of those, that's really important. Fiber plus a fermented. Then what do we do next? We want to continue to focus on reducing the chronic inflammation, support the energy, and we're going to talk about, Lizzie's going to come behind me today and kind of talk about some of this, and prioritizing rest and energy, saving energy. So just quickly about the gut microbiome, feed the gut correctly. Fiber and fermented foods, organic, preferably organic. Heavily sprayed produce contains chemicals that will actually destroy the gut microbiome as well as the mitochondria. Avoid antibiotics if possible. These raised without antibiotics, look for that. We want this anti-inflammatory diet, highly processed foods, and no seed oils. Learn to read the label. It's really, really important. Look for things that are high fructose corn syrup or oils, okay? And avoid those like the plague, okay? And we've kind of gone over this a little bit. The things that damage the mitochondria, and stress is one of them. Stress actually has a negative impact on the mitochondrial functioning. and then the good things. Some supplements here that can be used. I want to just quickly put this up. I know it's very, very busy, but I want you to understand that what you put into your body as far as medications can actually have a negative impact on mitochondrial functioning or insulin. So antidepressants, antipsychotics, statins, all these things. So it just, and I think I heard this earlier, sort of be aware of what you're putting in your body, because what you put in can have a negative impact. And if we are working on trying to decrease inflammation, improve energy, and decrease pain, then these are the things that only you can do. Okay. Some of the non-pharmacological interventions categorized into these sort of groups. There are some interventional kind of stuff, surgery blocks, etc. Alternative medicine, yogurt. That's really good too, by the way. Greek yogurt, unflavored, please. Okay, yoga, Tai Chi, etc. Pastoral services and psychological. All this is within the context. So I know I'm being pushed off now. Sorry, guys. I think we've kind of gone over the majority of all the other things that need to be done. I'm sorry I really talked on and on, didn't I? Okay. Okay, and one thing that I would like to say is just a helpful phrase is stop now to protect tomorrow's energy level, okay? All right.